and then provide care for a client diagnosed with what? Serotonin syndrome, what? Mental health. Are you having issues with mental health? Let's try these 10 questions and see how you're doing. But I know you're going to get it. Patient have what? Serotonin syndrome. Which of the following finding is consistent with what? Diagnosis. I want you to select only two. Select only two answers, not all of them. That means there's only two answers. I'm just telling you, there's only two answers. Clonus, erythrosia, diaphoresis, bradycardia, and temperature 104. What do you think? Let me show you the key. The key word is what? Serotonin syndrome. Serotonin syndrome happens when you combine two serotonin. You're taking an SSRI or you take some medication that has serotonin. Then you ask yourself, what should I expect? Everything goes up. No matter what you have, it's going to go up. Symptoms are going to go up. How do I pick the answer choice? Pick an answer choice that is going up. Clonus means things are going up. Reflexia means things are going down. You see how I'm approaching this question? That's the way I want you to approach it. Diaphoresis, hey, you sweating, things are going up. Bradycardia, things are going down. Temperature 104, things are going up. But I'm going to take it, but I'm going to tell you, in serotonin syndrome, your temperature will never go to 104. It can go up to 102, but 104 is too much. 104, you get into NMS range. Neuroleptic malignant syndrome. Therefore, 104 is not consistent with the serotonin syndrome, but your temperature goes up. So I just want you to I put it there so that I can teach you specifically about that if you see it on the NCLEX. Now, this is a case study, a very short one, and let's review the clinical data to develop a plan of care. Which condition the nurse should suspect a client is most likely experiencing? 2 actions to take and 2 parameters. This is a Bowtie question. And then you click on it and you read it. A client arrived in the PACU after 3 hours of what? Hysterectomy, patient had surgery. And how to answer questions on case study, look at the first 2 lines. You figure it out. Patient had surgery. Client is alert, oriented to time, place, and person and situation. I'm fine. My temperature was okay. Heart rate was fine, right? My heart rate was also fine. My blood pressure is fine. Respiratory rate is okay. Saturation is 98, 3 liters because he had surgery. Okay, what is going on? The lung is clear. S1, S2 present. Everything is normal. Why are you giving me normal numbers? That's what the NCLEX. It's a normal situation. They're trying to show you how things happen in real life. That's me too. I'm trying to show you. I'm getting NS at 75. I'm okay. 30 minutes later, I'm visibly short of breath with labor breathing. My jaw is locked. My end-tidal CO2 is high. I have very stiff and warm to touch. My temperature is 103. My heart rate is high. Everything is going up. I have irregular. That means I'm getting sick. You can see these are all signs and symptoms of things going up. If this is the problem, things are going up. What is the problem? I just had surgery. What do you think is the problem? That's all. Now, look at it. What condition is this patient suffering from? Is it thyroid storm? Is it serotonin syndrome, neuroleptic malignant syndrome, or malignant hyperthermia? Then after you find a diagnosis, then you can treat it. Then when you treat it, you know what to monitor for. This is how you answer Bowtie question. Therefore, let's break them down. Thyroid storm. The patient had surgery. They never touched the thyroid. They said he had hysterectomy. Therefore, you know this is not thyroid storm. So it's gone. Serotonin syndrome. You get it when you have what? You take medication associated with serotonin. Patient never take any medication associated with that. This is the way you answer questions, right? Straightforward. Neuroleptic malignant syndrome. It happened when you take antipsychotic. Patient was not taking antipsychotic, just had surgery. This is malignant hyperthermia. Now, what action would you take? The action would you take is to cool the patient down. Cyproheptadine is used for SSRI, so it's not good. Dantrolene is yes. That's what you use for malignant hyperthermia. That's one of the medication you will use for that. Does the patient need immediate cardioversion? No. What they need is aggressive cooling. And therefore, we're going to give them dantrolene and you're going to provide aggressive cooling. Now, after you do that, What are you going to do? The temperature is very high. They're going to get sick. What are we going to be doing? We're going to be monitoring the temperature, right? And then what? We're going to check their mental status. These are the things that we have to pay attention to because that's the most important in this situation. Very, very important. But all the other options are reasonable. But the key is to monitor their temperature and check their mental status because they're going to get sick and sick and sick from it. So this is the way you answer these kind of Bowtie questions. And when you see it, I want you to be careful so that you don't get trapped. A client statement, you are of the FBI plotting to kill me. I know it. That's what they said. The nurse interpreted this as what? Is this delusion of reference? Is it delusion of somatic? Is it delusion of persecutory? Is it delusion of grandiosity? You are a part of the FBI. You're trying to kill me. That's a fixed belief. That's a delusion. But there's different kind. What is the patient trying to do? Is he referring to somebody, right? Reference. Somebody is talking to them. That's the delusion of reference. I don't think so. Somatic. Is it the body talking to them that my body is weak? I have cancer in my body. That's delusion of somatic. Delusion of persecutory. That means they think you're going to do something to them, right? Or delusion of grandiosity, trying to raise themselves up. I don't see the patient raising themselves up. I don't see the patient saying their body is affected. I don't see the patient is receiving messages through a TV. Therefore, this delusion of persecutory. So that's the way you answer that question. That's the explanation for that particular question. Now, and this is collecting data on the client in the mental health. So these are all mental health issue, mental health concept. There's a reason why this can be difficult, but I want you to get it. Stay with me. I'm going to get you through this. This is the key. It's a case study. Which condition the nurse know the client is most likely experiencing? Go for the buzzword. And I'm going to underline the buzzword as we go through each of one of them. The client report what? Intense. What is the problem? Vivid flashback. Oh, associated with anxiety and hyperarousal. Oh, this is what he's saying. The client has witnessed what? Experienced traumatic. That's the key word. But cannot recall certain details about this event and has become anxious both when questioned about it. So hypervigilance, right? He cannot remember the encounter, right? You report difficulty falling asleep is affecting their sleep. He's hypervigilant, emotionally outbursts. He has difficulty concentrating, nightmares, interfering with the life. I know the way I read it, I know you got it. What do you think is wrong with this patient? Is he generalized anxiety? It looked like that, but that's not it because of the reliving. Acute stress disorder, yes, something happened acutely, but there's more than acute stress disorder. Post-traumatic stress disorder, what do you think? Obsessive. He's not obsessed about anything. He's worried about, he's most likely suffering from post-traumatic stress disorder. So those are the key. He has all the hallmark of that. Flashback, anxiety, hyperarousal, hypervigilance, and difficulty sleeping. Those are the buzzwords. I want you to write it down. And those are key. Now, NS provide care for several clients. When caring for which client, the nurse should initiate established trust. That means who I need to establish trust in that patient. What do you think? First, who are you going to establish trust for? Somebody with aggressive and violent behavior, do you need to do that? Persecutory delusion, do you need to do that? Somebody with schizoid, do you need to do that? Paranoid, and schizotypal. Which of these patients, step back and think about it. If I have to take care of this patient, who do I need to establish trust? Put down your answer in the comment and let me know. But any patient who is aggressive, you got to establish trust so that you tell them we're on the same page. I'm going to be cool and you're going to be cool. You're not going to hurt me. Somebody who has persecutory delusion means, well, you got to be careful. Everything you do, you think they're going to kill them. Therefore, and schizoid is a portion of schizophrenia. They have some form of delusion. Same thing as schizophrenia. Those are all classics. So you have to be what? close to them and be able to establish trust. And if I'm paranoid about everything, you got to establish trust. All of us, we are in trouble. And then supervisor yell at the nurse. This is our mental health concept, saying you are incompetent and don't know what you are doing. That's the nurse supervisor talking to a patient. The nurse did not respond, did not say anything. 5 minutes later, the nurse yelled at the client saying, you are annoying just to take your medication. You are annoying, just take your medication. What defense mechanism is that? Break it down. The charge nurse yelled at the nurse. I don't care what they say. It doesn't matter. Just summarize it and say, yell at the nurse. When the nurse went to the patient, instead of confronting the charge nurse, now the nurse is mad at the patient. That's no projection. When you're projecting, it's what you think you are, you think somebody is. Displacement, you're taking the problem that is bad on you and you put it on somebody else. You don't want to give it to the person who gave it to you. And there's no evidence of denial. She has accepted the fact that whatever was said to her, she did not respond to it. Reaction formation, she's not acting opposite inside her. She knows she's in trouble, but she put it on the patient. This is displacement. And that's the answer. This is a form of displacement. The nurse did not confront the charge nurse, but displays the frustration to the client. This question, I want you to write it down because they're going to confuse you. And NCLEX will give you select or apply and it will put wrong information there. Classic. Teaching the client with refractory major depression, scheduled for what? Electroconvulsive therapy. Which teaching is appropriate? This concept, I want you to stop the video, write it down, answer the question, but no ECT. ECT is done to what? Help with depression. After we've treated you for a long time and nothing is happening, we want to create seizure in your brain, and that may help with your depression. There's teaching you should provide to the patient. Avoid consuming caffeine before the procedure. Electric probe will deliver mild electrical impulses to your scalp. Wash your hair the night before the procedure. Is that okay? Is that teaching? You will require pain medication due to the procedure. You should not eat 6 to 8 hours prior to the procedure. You may not remember the entire procedure. You should stop taking your antidepressant. We will induce seizure lasting 10 to 15 seconds. Guess what? These are concepts they will ask you when they come to ECT. And I want you to know that it's very classic. It's very important. Because we're going to induce seizures in you, you should avoid caffeine. It's going to interfere with that, right? The electric probe will deliver shock. They don't cause pain. There's no pain associated with it, so that's wrong. You should wash your hair. That's fine. You're not going to require any pain medication because it doesn't cause pain. Of course, because we deliver seizures, you should not eat. You will not remember after the seizure is done because you have retrograde amnesia. You should not stop your medication. Keep taking it. And we will induce seizure lasting that. And so this is the things you should know about ECT. It's very important. So A, C, E, F, and H are the right answer. Now, this is, like I said, these are mental health concepts. This is problem with cycles of violence. Know this information. It's a simple question. When you see it on the NCLEX, it will be easy. Match each step with the proper description regarding it. Tension building, what is that? Explosion and an honeymoon. Think about it. When you are having cycle of violence, what do you think? When you have tension, what do you think? Is it verbal, physical abuse? Is it sorrow and feeling of guilt, or anger and abusive, argumentative? The tension has to build. Therefore, we're going to be talking at each other. And then I'm going to blow up. That's when I touch you. And then I will be sorry. I say, oh, sorry. I won't do that again. And this is the way it looked like. So master this concept. And that's the key. Tension building is the first stage where you're arguing, you're yelling at each other. Then crisis will explode where somebody is touching each other. And then we apologize. Cycle of violence. This is also a key concept about substance abuse. I want you to see the way I'm going to approach it, because substance abuse questions can be very difficult. I'll read the question from the back as usual and show you how I'm going to break it down. With substance abuse withdrawal, the nurse should expect, that means the withdrawal symptoms. And then provide care for a client in emergency room with what? Buzzword, visual hallucination. Which of these medication or drugs causes visual hallucination when you withdraw? You're going to have tachycardia. Things are going up. You're going to have slurred speech and talkativeness. Your pupil size is normal. What are you withdrawing from? What do you think? Is it alcohol? Is it cocaine? Is it opiate? And diazepam? I'll show you. The right answer is alcohol. Because of what? What do you think? Because of hallucination. That is key for that. But I'm going to show you other answers, why the other answers are wrong. Let's break them down, right? Opiate, your pupil is not going to be normal. It's either dilated or constricted, because it's downer. When you take in, intoxicate, it get constricted. When you withdraw, it get dilated. This is normal. Cocaine, when you withdraw cocaine, cocaine is what? Upper symptoms. So your symptoms should go down. This patient has tachycardia. It's not consistent with that. Diazepam is a downer. Your symptoms all go up, but hallucination is not specific. It's visual as hallucination, which is specific for alcohol. So that is very important information that you should know. And this is collecting data from a client struggling with what? Refractory major depressive disorder in the outpatient clinic. Patient has depression and nothing is working. We try everything. What information would you get from them? That is very concerning. Which statement by the client is concerning? They have depression. They're saying something. Which one should you worry about? I donated all my clothes to an homeless man yesterday. Guys, what do you think? I went to church to say my last prayer. What do you think? I sold my house at half price to get rid of it. What do you think? It's been painful, but I'm looking forward to tomorrow. Life is not easy, but I'm hopeful about my disease. When you see these questions on the NCLEX, the best way to answer is what? You are managing the problem. You are doing what? Coping. When it comes to psych issue, that's the word you're looking for. Which of these answer choice means I'm coping? The disease never go away, but you cope with it. I donated all my clothes to homeless man. That means you're giving up. You're ready to go. And that is no coping. I went to church to say my last prayer. That is no coping. I sold my house at half price to get rid of it. Just basically, I want to get everything and go away. That's no coping. It's been painful, but what am I doing? Looking forward for tomorrow. Hopeful, I'm coping. Life is not easy, but I'm hopeful about my disease. Those are the concepts I want you to know about depression. All these three, ABC indicate suicidal ideation. D and E indicate coping mechanism.